BC's mental health minister says the province will get it right in detaining people suffering from severe overlapping mental health and substance use challenges.
Some of these people are a risk to themselves or others and can't make decisions about their own care.
Dr. Daniel Vigo has created guidance for clinicians to properly interpret the Mental Health Act. Vigo says less than 1% of patients require involuntary care.
The document will settle some of the spurious controversies generating during the past decade around the use of the Mental Health Act. Controversies that have tied the hands of many physicians and created barriers to the care of people with substance use disorder in the moments of greater need.
But some groups in Vancouver's downtown east side say no.
Involuntary treatment, it'll really bring a lot of harm to people, especially First Nations people.
The Vancouver Area Network of Drug Users does not want involuntary care treatment for substance use. Instead, peer-led sobering centers in the neighborhood, detox treatment on demand, and access to safe supply.
The government's forcing of involuntary treatment is simply setting a person up to fail because a person has to be physically, mentally, and spiritually ready to enter treatment.
It's something backed up by the Canadian Mental Health Association. It says the need for access to voluntary, evidence-based and trauma-informed treatment and recovery services has never been greater, with concerns about oversight, transparency, and accountability with involuntary care. Meanwhile, the BC Conservatives want the Mental Health Act amended to improve communication between close relatives and healthcare providers when a person is brought to hospital in a mental health crisis.
The Mental Health Amendment Act 2025 can assure that doctors and nurse practitioners have more information to help them in their assessments, keeping people with mental illness and the public safe.
The province says its approach is multifaceted, with funding for substance use care, child and youth mental health, harm reduction, and recovery services. New involuntary care beds are set to open at Alouette Homes in Maple Ridge and at the Surrey Pretrial Services Centre this spring. Chad Pawson, CBC News, Victoria.